And then what do you think is the best way to see if a parent is doing better at focus, organization, and follow through? Is that kind of the report card or the daily report card of the behavior schools or progress books, something like that?
If the parent is following through, is that what you said?
Sorry, if a patient.
Oh, okay. I thought you said if the parent.
I probably did. Sorry.
Yeah, I mean, that kind of gives us an idea that they're making progress. Mm-hmm. I mean, they might have something different. Like, had a kid recently that wanted to be a pitcher on his baseball team, and he thought his medicines actually helped him focus better even on the baseball field. So, and kind of could give me an example that before he wasn't ever picked to be pitcher because he wasn't paying attention to the game, and now that he was on his medicine, he could. So, I mean, whatever goals they have or objectives they have in their life, they can give feedback about it.
There. That's great. I'm just typing it. And then how does this information, kind of what we talked about in collecting with the Vanderbilts, with the report cards, with the narrative from the parents and the child, how does this information kind of help inform your treatment decisions?
Yeah, I mean, that's just kind of one piece when we're talking about medication management, like is it effective? The other pieces are, is it tolerated? Is it affordable? Is it being remembered? Are they compliant? So, I mean, whether it's effective is just kind of one piece of it.
Okay.
But certainly like promotion, because if it's not effective, all that other stuff doesn't matter.
Yeah, you're right. So it's almost like to consider going on it, the affordability is important, but then the effectiveness is also important once they're on it, but then the toleration, the side effects, the compliance all contributes to that.
Yeah.
Okay. So at follow-up appointments, how do you kind of see, like, if there's good days or bad days? Like, in helping the parent kind of identify how to have more good days?
Yeah, that is an interesting question because sometimes, like, just the parent is having a bad day, and you don't know, like, if this is a continual problem or if this is just a one kind of day thing. So yeah, that you kind of have to tease that out to see whether there are more good days than bad. Like, if I have a question about that, sometimes I'll ask for them to keep a calendar, like if every day is horrible or, if there's time in between. Now, that doesn't ever go over very well because nobody ever wants to keep a calendar, but usually that kind of tells me that maybe it's not horrible every day, when I ask for something like that. But yeah, if there's something that worked at Grandma's house and something that doesn't work at your house, like let's figure out what the difference is and try to continue that. That happens a lot.
Okay. And then so it sounds like you use the Vanderbilt as a clinical assessment and follow-up. Is there any other assessment you use?
For ADHD?
Yep.
Yeah, I think the Vanderbilts are the main one we use, yes.
Yep. And what do you think, are you aware of kind of any clinical assessments that do a good job of looking at those real world implications or impairments like mornings or bedtime or, kind of getting out the door, that sort of thing?
What did you say? What's the limit?
Are you aware of any clinical assessments that are out there that you may not use but exist or that you've heard of?
No, not that I know of.
Okay. And how about, have you heard of any clinical assessments that do a good job of kind of measuring self-esteem, relationships, or academic success?
No, I don't have any. We don't
Mm.
have anything that we purchased that we
Okay,
that we use. So the stuff that we use is basically able to be found and free.
great. And what are your thoughts on setting treatment goals around kind of specific life domains like relationships, academic progress, self-esteem, instead of symptom categories?
Well, the only thing about that is that it can kind of vary and be hard to sort of quantify. But I think they kind of get mixed in together. So if somebody's goal is to be less hyper and to interrupt less, then that certainly is going to affect their relationships with others. But it's kind of hard to say, we'll have 2 best friends by the end of the year. That's like just kind of hard to quantify, I guess, and hard to, too many variables with it, I guess. Yeah. But I know, especially for the half of my patients that are in therapy, they will set specific goals like that too. And, once they kind of reach a certain goal like that, then they'll move on and make a different one. So.
And then, do you use what are your thoughts on a daily behavior report card? Would you recommend it?
A what?
A daily behavior report card?
Yeah, I mean, a bunch of my schools and areas that I do that.
Mm-hmm. And do you like it? Do you think it's helpful?
Yeah, I think it's helpful.
And how so? How does it help you as a healthcare provider?
It kind of gives me, the ones that I get to look at are either from a teacher or a mental health care provider in a like a partial hospital program. So it gives me sort of an educated person's assessment about how the child is performing during the day.
Mm-hmm. Okay. And then just kind of moving on to the idea of treatment plans. So what is the frequency of changing? Like, how often do you change a treatment plan for ADHD pediatric patient?
So in our agency, a doctor redoes the treatment plan once a year, and the therapists redo the treatment plan every 90 days.
Mm-hmm.
So somewhere in between all of that is how often they sort of get updated.
Mm-hmm. Okay. And why do therapists do it every 90 days compared to doctors?
No, that's the requirement.
Okay. And then how long are kids typically on a treatment plan? They may be different ones, but just overall.
So oftentimes a doctor's treatment plan is, will continue their medications and attend appointments, and the medications are what actually reduce the symptoms. So they're on it till they decide to not continue that. We don't really cure anything; we just treat symptoms. Mm-hmm. So some of them can be on it for years.
Yeah. And what is the impetus for changing a treatment plan?
Well, if they've reached their goals, or if they've decided they have different goals. Mm-hmm. Those are some main ones. Or if their level of care changes, the kids that do come into the partial hospital program that I run do have to update their treatment plan that they need a daily treatment instead of weekly or whatever.